Hi everyone, today I'm covering a very interesting topic, this complication of a Caesar scar. Okay, many women out there today have a Caesarean birth. We have a Caesarean birth, you need to know about this and you need to know what you need to do. These women will usually tell me that they have this little bit of spotting. They have this little bit of spotting every month. And they have seen so many gynaes, Some gynaes give medicine, some gynaes give antibiotics, some gynaes give hormone tablet, but still the spotting continue. Been seeing this problem, and I have been telling the patient, this is because of your Caesar scar. There are few things, I've noticed it on and off when we do an ultrasound scan on a lady who had a previous cesarean. We can actually see a gap. We see a gap in the Caesar wound. Let me show you what a vaginal ultrasound will look like. This is what a vaginal ultrasound will look like, a normal vaginal ultrasound, okay? So what I mean by the gap, look at this. Same ultrasound picture, but can you see the gap? This is the gap in your Caesar scar. So to compare, I have a picture of comparison. So they are both the same uterus. This one, I don't see the scar. There's nothing, it's nice and smooth. So this person has a nice uterus, probably no Caesar at all. And this is one with a gap. So what happened is that sometimes our wound do not heal so well. It's called isthmocele, or sometimes we call it a niche. It can be, number one, be during the suturing, closing of your uterus. There was at one time a trend that we shouldn't suture, we shouldn't sew it 2 times. Actually, in a Caesar, we always sew it double. But there was at one time that they want to compare and they say maybe it's okay to just sew 1 time. Okay, so let's say you only stitch 1 time, could be a problem. Or if the doctor stitched that time, they didn't take a full bite. That means they just close it up. But there are certain areas that they forgot to take a full bite, because it's quite common to have that problem. Why? Because your uterus is so big, so when you take out the baby, sometimes the whole wound actually pull open. So certain parts, the muscle actually retract. So the muscle retract. So sometimes when we stitch, we may be only stitching the skin of the uterus and not the entire muscle of the uterus plus the inner lining. Because actually uterus have 3 layers. They have the outer lining, the muscle and the inner lining. You are supposed to stitch all 3 together, but sometimes the muscle pull out, so that is it's quite difficult to bring it all together. So sometimes maybe miss certain area, not the entire wound, because most of us gynae, we know we need to take all 3 layers. So we also worry maybe certain areas missed out, or it could just all be part and parcel of wound healing. That means we stitch up properly, but somehow the wound open, which can happen because even you see for natural birth, we definitely stitch nicely already because it's in front of our eyes, so easy to see. But somehow the wound also open up. So wound can still open up. So there is still a possibility that it happened because of wound healing. So when your Caesar wound healing, if let's say it opened up during the healing process, you will have this gap that I show you. Isthmocele, number one, the first thing it can affect is it can affect you as a lady with a previous Caesar. You may have certain symptoms. It's the little spotting that you get every month. And that is what I mentioned, that some women with this gap, they actually get it every month, but not all. So this little bleeding every month is due to this isthmocele. So you have to solve the isthmocele to be able to stop this bleeding. You take oral contraceptive pill, yes, your bleeding is okay, but you stop, then the spotting come again. So how are you going to take oral contraceptive pill forever, or are you going to treat this problem? Number one. Number two, the other pain they can get is period pain. But their period pain is not just any pain. They have this one spot they can use their finger and point. Displaced pain, and it's usually just above where the Caesar scar is. So when you have Caesar scar pain at a one spot every month, we do need to think about this isthmosil, or we can think about Caesar scar, endometriosis can also happen. So please subscribe to my YouTube channel. Okay, thank you. Bye bye.